It is Tuesday, September 29th, 2020. Welcome to the Kahnawà COVID-19 Task Force Update. This is our 134th episode. It has been, needless to say, a very busy week, a very eventful week, and there is more to come. So decisions have been made, and more decisions are going to be coming up. The best way to get the information to you is to go straight to the source. We have been doing that all along. Joining us on today's program will be Westaway and also Dwayne Zacharie from the Kahnawà Peacekeepers. We'd like to start things off with the head of the task force. He is also the Commissioner of Public Safety, Lloyd Phillips.
Thank you, Joe. Good afternoon, everybody. Hope you're doing well and doing your best to stay safe. Certainly trying times here in Kahnawà, and certainly around the community in the South Shore region, Greater Montreal, and so on. As we see, the situation regarding COVID-19 is evolving very rapidly. Things are progressing much faster than most people had anticipated. Just a few weeks ago, we were talking about some areas in Quebec were in their green and yellow, and now we're looking as things evolve around us. And as you've seen, if you didn't see already, the Greater Montreal area will be going into a red alert effective on Thursday morning, actually midnight, 12:01 on Thursday. Greater Montreal area does not only include Montreal Island, it includes Montreal, Laval, much of the North Shore, and much of the South Shore. And geographically, it includes Kahnawà, but obviously we're not officially part of the Greater Montreal region because we are our own jurisdiction. The situation, I wish I could tell you, was getting better, but unfortunately, it is not. Our last update in our last task force meeting, we had just yesterday to give an update on what was happening in the community. Literally, as we were in our meetings, there was more information, coming in as we were in the process of meeting. And again, literally, as we were doing our Facebook Live, there was a press conference being held by the government of Quebec outlining some of their measures that they're taking. So, we did a full assessment on what is happening, more importantly, what's happening in Kahnawà, but also obviously what is happening around us, looking at some of the key indicators that we had talked about before, about contact tracing, about the percentage of positives, and the overall infection rate in and around the community. All of these things are obviously not where we want to see them. So, with that said, obviously there is going to be a full task force meeting tomorrow to have further discussions, but all indications is that we are going to have to move to the next level. We weren't in the orange level very long, but it looks like all indicators we'll have to move into a red level very soon. That will be formalized at a discussion to take place tomorrow with the task force meeting. Many considerations got to take into account. Primarily, as we said many times, our community is very vulnerable due to the close-knit of our community. All our families live here. We have a lot of elders in our community, a lot of people with predisposed conditions. So those are things that we have to take really closely and take that to heart in everything that we do. Things overall in the community right now are stable. There's no need for people to have a sense of panic. Things are under control, but we have to act now to keep it that way. We have to do what we got to do on a task force perspective, from a community perspective, on an individual perspective, from a business perspective, to ensure that we do everything we possibly can to keep those numbers very low and to ensure that we do our best collectively as a community, as we did during the first wave, to ensure that we don't have no death at the end of the day. Things, again, unfortunately, are not going in the direction that we hoped. Today, the KERM Fund, the Kahnawà Economic Relief Measures Fund, was put on alert. They also had their mandate extended by the Mohawk Council of Kahnawà a couple of weeks ago, so they are ready to go if they need them for the foreseeable future. What exactly a red level alert will look like needs to be further outlined, and that will be done through another Facebook Live that we will be having tomorrow with much more details exactly what this means for each and every one of you, what it means from a business perspective, a community perspective, and as well, obviously, the overall impacts on you, maybe even psychologically, because we understand it's a very stressful time, a lot of anxiety in the community, but again, through our collective will as a community, we will get through this. This pandemic second wave is coming at us in a different way than the first wave. Right now, the primary infections that we're seeing are, with, generally speaking, not just in Kahnawà, but across the province, across the country, is with younger people. But if things remain as is, and in Quebec we've seen today close to 800 cases more, it's only a matter of time, if things are not under control, that we will start seeing the vulnerable population be hit. And unfortunately, as we've seen in the first wave, they get hit very hard. So we'll do everything we possibly can to stop that from happening. And it's only through the collective, family, close-knit way we are in Kahnawà that we will do that. So with that, I certainly will be back tomorrow with much more details on this. I know there's many questions that the community has. We see it on our Facebook page. We get emails and phone calls here, including some very positive comments we received today from some elders in the community, urging us to take the next steps and giving some of their heartfelt support to the task force. So I certainly do appreciate that. But tomorrow we'll be here with more information, and we will do our best to answer all your questions as they come in. So thank you very much, and I'll see you soon. Anigawahi.
Nyaukoa, Lloyd. During this time, the peacekeepers have been very busy, but as we recall, back in the days of April and May, they had a tougher job than normal, and things had quieted down. But as things ramp up again, we thought it was a good idea to bring back the chief peacekeeper, and let's welcome Dwayne Zacharie.
Good afternoon, Kahnawà. Happy to be back here just to give you a little update on where we stand today, and to kind of follow suit with the information that Lloyd gave you. I have some updates to give regarding border crossings, essential workers, red zone people, and enforcement. So one of the things that the task force has to deal with and fields numerous calls on is the issue of border crossings. And I think lots of people are misinformed, or lots of people aren't paying attention to what the rules are. So if you travel into Canada from outside of the country, meaning coming in from the United States or anywhere else, you are required to self-isolate, okay? You must self-isolate. We're urging people to follow the rules. We need to make sure that people are safe. We want to mitigate the damage that the coronavirus can do in our community, and it's essential for all of us to be partners in this. So that's why I'm here. It's an update. And listen, lots of people are calling us and saying, well, my boss said I'm essential to his or her business. Well, that's great. If you're that important, good for you. But the issue is, are you an essential worker? If you don't fall into the vein of a first responder or healthcare worker or somebody that deals with critical infrastructures, hydro or natural gas, and workers who are essential to the supply of goods to society, meaning critical goods like food or medicines, it doesn't qualify, okay? If you're important to your job, good, but it doesn't make you an essential worker. So you have to make sure that you understand that. If you think that you're an essential worker and you continue to go to work and kind of contravene the rules, then there are consequences to that. And Throughout the time of the pandemic, the Kahnawà Peacekeepers have worked very closely with the community. We've built up an excellent rapport with people, and that's all through community policing. That means trying to educate people, trying to get people to come along and respect the rules, trying to get people to understand that it's important for everyone to be our partner on this, okay? But we still hear about lots of people who are coming back from the States, lots of people who are coming into the community and not following the rules. And the next thing, or one of the things I had on the list, was enforcement. So we're going to do our best to continue to do community policing, but just be aware that in this second wave, enforcement will be one of our main priorities. So some of the enforcement issues that we have or one of the tools we have is the issuance of tickets or infractions for failing to comply with the directives as per our emergency preparedness law. And the fine is over $1,000, right? So please don't put us in a position where it's the only resort. We want to work with you as much as we can. So please follow the rules. It's important for everyone. And I keep saying this, you know, we expect to be good partners with our community. That means community members being good partners with us and following the rules. We have a number of people from outside our community who come into Kahnawà every single day to provide critical services to our community. Hospital workers, first responders, people all in that vein for essential workers. And they are under different rules and criteria from other people, meaning we hold them to a higher level, a higher standard. We want to make sure that they're being safe. When they go home at night, they have to stay home. We're expecting them to do much less out in public. We expect them to stay home. We try to get them to have people go and do their groceries, to do their errands, because we need them, and we need them to be ready and prepared to provide services to our community. So if people have questions about people coming from outside the territory to do some of that critical work, by all means, call me at the Peacekeeper station. I'll answer your questions. I'll work with you on this so we have a good understanding, so we can all continue to work together. The reason I'm here today is to urge people from the community, Kahnawà, help us out. We need your help. We work here all the time in the task force room. The task force people work tirelessly to create a safe environment in our community, but the only way it's going to be safe is all of us follow along and do the things that we said, you know, the rules, distancing, masking, hygiene, all of that stuff is vital. I'm going to go back now to the first part of my talk, where I talked about work-related travel and work-related travel for essential workers. And I just want to make sure it's clear. So at the end of this, if you still have some questions or there's some things not clear, by all means, give me a call at the Peacekeeper station and I'll explain everything. So at this time, we're asking all people who do not have to travel to not travel, okay? So non-essential travel, don't do it. I understand people have to go to work. I understand people have to make a living. I'm not saying that that can happen. I'm just saying think about where you're going, think about where you're working, and think about your return to our community. You have to be smart about it. You have to be responsible. That's what we're asking for, and that's what we're asking and urging people to do, to be responsible. When you return from the United States or anywhere else outside of Canada, they require you to isolate for 14 days. I know lots of people say, when I crossed the border, nobody told me anything. It doesn't matter. That's what you're required to do. The Quarantine Act is still in effect, right? It's got nothing to do with the United States. The United States has their own rules. Canada has a different set that they're invoking right now. And it's got nothing to do with who you are or where you come from. It's to mitigate the spread of the virus. That's why these rules are in effect. For essential workers, they are exempt from self-isolation, but you have to be on the list of people that I mentioned before. It's not because your boss said you're essential to his or her business. It's because you are actually an essential worker. First responder, paramedic, doctor, nurse, those people, critical infrastructure, all of that stuff. That's what qualifies as an essential worker. We are asking, again, I keep saying this, we're urging you to cooperate and participate with us. We need your help. That's the only way that we're going to get through this. We're hoping that the second wave goes a lot smoother than the first wave, but we can't tell. It's still early, but by all accounts, it looks like it's going to be rather serious, okay? So now is the time to start preparing and getting ready for what's about to happen, all right? Kahnawà, Kahnawà.
And yeah, Dwayne, and a good point about being prepared for the second wave. Remember, we've been through the first wave, so we have some experience. So in all reality, we should be able to do better. So let's keep that in mind. Joining us here is Lisa Westaway from the Kahnawà Memorial Hospital Center. And of course, with all of these drastic changes, certainly the hospital and other organizations like that will be affected. And here with her update is Lisa.
Thank you. I'm going to start with a message similar to what we gave on the radio this morning. And it's complementary to what Dwayne just said, because I know he's talking about our individual responsibility, and that is true. But there is another side to that message, and it's that despite how responsible we are, we still can get COVID-19, and we still can transmit COVID-19. So there are two parts. We all have a very big responsibility to follow the measures to protect the most vulnerable in our community, and we all also have an equal responsibility to respect each other, to be kind to each other, and to work collaboratively to fight COVID-19. And again, as we mentioned this morning, this is not about shaming or blaming. Facebook can sometimes be a breeding ground for hate, as I was told often enough. We need to keep that in mind, that our words matter, what we write matters and impacts all of us. And therefore, if we're being kind to each other and if we're fighting COVID-19 together, then how we what we say makes a difference, and how we treat each other makes a difference, and it's only together that we can fight and be stronger as a community. So I want to talk a little bit, I'm going to repeat some of the messages as well that were given yesterday. I want to talk a little bit about the testing site first and foremost, because I know many of you wait for numbers. As we mentioned, our numbers have been increasing steadily at the testing site. Yesterday, 35 people were tested, today 33, and now the testing site will be open 5 days a week. And so again, if you have symptoms, we urge you to call the testing site and you will get an appointment. One of the cornerstones of keeping the virus or transmitting the virus as little as possible is isolation and contact tracing and identification of cases. So if you're not getting tested and you're not self-isolating, if we're not identifying who the contacts are, then it's going to have a huge impact on the community because we will not be able to control the virus. So that being said, what we need from you is, number one, to answer your phones. Number two, when we do call you for contact tracing, to provide us with as much detail and information as possible about all the places that you may have visited over the time period that we're asking you about. And in order to be able to do that, we need you to start, as of now, being mindful about your day-to-day habits. It could mean writing it down if for some of you that is helpful. Writing down where you go and who you might have seen in a day would be really helpful to us. Why do I say this? Because any of you can get COVID-19 at any time. Despite what you might be doing in your day-to-day life, any of you can get COVID-19. And for us to control transmission of the virus, the more you know about who you saw when and whether you were wearing a mask or not wearing a mask, those details can be very helpful to us in limiting transmission of the virus. So please, if a responsibility that we're asking of you is to start paying attention to your day-to-day habits and writing them down if that helps. We now have 5 positive cases in the community. So this is an additional case that has been identified today that is not at all related to the first cluster of cases. And I want to talk a little bit about that because, again, there's a lot of when we don't have a lot of information, we make that information up. And there is a lot of misinformation out there. So it's really important to know cases, when we do a contact trace, when we speak with somebody, a positive case, we go far back to better understand where the case started from. And remember, if we're able to trace back where the actual localized or where the first case came from, then it gives us a better means of controlling the virus, but it also tells us that perhaps we don't have community transmission. So the goal is to always be able to trace back to the original case. So for the cluster of cases that were identified, I just want to clarify that that started external to the community through a gathering that transmitted the virus into a school outside of the community, which then brought the virus into the community and then spread outside of that through gatherings. So again, we talk about gatherings being the central area for transmission of the virus, and our habits within those gatherings, whether it be in the community or outside of the community. This last cluster stemmed from a gathering outside of the community and was transmitted also through gatherings inside the community. With that, I want to explain to you or show you a graphic that we stole from somewhere else, but we redid it. Anyway, so this kind of gives you a little bit of an example of what we see as what we think our bubble is. So that circle in the middle with just a few small people, that's what we see as, or what we think is our bubble. We think that if one of those people, first of all, we think that all those people in the middle are safe. In fact, nobody is safe right now, okay? So it's very important for you to put that into your minds, to know that the most you can do is control your environment. That is the control that you have. So you have that bubble in the middle where you're all controlling your environment. But what you think is that environment is actually the bigger picture. So if you look at what's in the bigger circle, then you're getting a better idea of exactly what your contacts are. Because every single person has a contact outside. And we all do. We all do. Despite how we distance, hygiene, and masks, unless you are staying home and not leaving your home and not leaving your family bubble ever, then you potentially have this type of contacts. Which means that if somebody in that smaller circle becomes positive, then we need to know, as the public health team, we need to know who all the people are in those other bubbles in order for us to ensure to contact those people, to help them self-isolate and limit transmission of the virus. This is really, really important. And it would be really helpful when we call, if you happen to know people's names and phone numbers, that makes it even easier because it takes a huge amount of time to locate all of that information to be able to contact people. But of course, the best you can do is wonderful for us, and we'll do the rest. So that's the first thing that I wanted to mention. Last night, KMHC put out a communique identifying that anybody who was at Poisson Funeral Home on the 18th between, I believe it was 3:30 and 5:30, that they should self-isolate. So we did attempt to contact family members, and I must express I'm really sorry if we did not contact everybody that needed to be contacted before we released this communique. Unfortunately, there were some people we were unable to reach, and we did need to release that last night. Now, I want to clarify risk in that situation, because this is what we spoke about a little bit yesterday on Facebook Live, but it's important to talk about it again. So, what is a contact? Maybe we'll pull up the document that we were looking at yesterday. So this was created by Dr. Gauthier and Neil McCumber, and what this is a chart, an algorithm chart, to help you better understand what your level of risk is and what a contact is. So that little asterisk at the bottom, which explains what a contact is actually the most important part of this document. So I'm going to explain that to you again. A contact is within 6 feet or 2 meters of each other, two people who are within 6 feet of each other for more than 10 minutes without any mask. That is considered a high-risk contact. So if you are in a category like that with somebody who is positive, then we would send you for testing and we would ask you to self-isolate from the date of your last contact with the positive case. If you were the wife or the spouse or the friend or a work colleague of that person who was in contact with the positive case, then there is nothing for you to do but self-monitor for symptoms, okay? And when we showed you that video yesterday from BC and we showed you the document that came from BC, if you're questioning how that works, how contact tracing works and isolation for contacts of contacts, then I really urge you to look at that video again, because it gives a very good explanation and a clear explanation, better than I can do verbally, that would give you more information about how that works. This document, the way it works is that first column is I have been. So whether you've been in contact with a positive case, whether you've been tested, whether you've been in a place where there was a positive case. And if we talk about the, if I go back to our specific example of Poisson's funeral home on the 18th, this communique that went out is we consider people who were at the funeral home at that time to be low risk. We have already identified those who are high risk and we have contacted them. So anybody else is considered low risk, but because we're unable to identify you and we're unsure of the exact level of contact, we ask you to self-isolate for those who were there during that period of time. So this document is very useful. It's on our website. I think it was highlighted yesterday as well. And we urge you to consult it before you write and ask questions, because you have information at your disposal. And the idea in giving you this information is that you feel empowered, that you feel in control. If you constantly need to ask the questions, it takes away your control level. And we want you to have control. So we want you to have the information and we want you to access that information so that you can make decisions. Of course, if you do have questions, then our local public health team can answer those questions. Okay, so we've talked about testing, we've talked about the site that's open more, we talked about our bubbles, and we talked about original, where cases originate from. These are all of the things that the local public health team does once we establish a positive case. And again, there are positive cases in the community, and as we mentioned this morning on K103, we're at a time where where you would want to assume that any person you come across is a potential positive case, and therefore you would act accordingly in a respectful way by keeping your 2 meters, by wearing your mask, by using proper hygiene methods. So I'm going to go back to testing and talk a little bit about wait times, because we are getting questions about wait times. And as we have been speaking about, wait times are increasing drastically. So The ministry has announced that they're now performing up to 30,000 tests per day in Quebec. We see that our testing site has increased drastically. We were at 5 tests per day just a few short weeks ago. We're now at 35 approximately over the last 2 days. And so, as you know, one area that we don't have control over is how quickly we get back test results from the lab, because we don't have our own lab here. And no, we cannot have our own lab here. It requires specialties that don't exist here, as well as access to materials that is impossible for us to develop. But where we do have control is in who we test. And this is why it's important that we follow the priorities for testing. So the ministry, or Quebec, has highlighted 2 specific scenarios or priorities for testing. Number 1, people who have COVID-related symptoms, so COVID-19 related symptoms. And number 2, those who had a direct high-level contact with a positive case. So remember, I described that over being within 6 feet over 10 minutes of a positive case. So those are the priorities, because those are the cases that when we identify them, they allow us to make decisions that limit transmission of the virus. So I want to just explain that really clearly. It's why we don't just randomly test contacts of contacts. So if we look at the research, all of the people who are tested without symptoms or contacts of contacts, the number of positive cases that we identify from testing those particular groups of people are very low compared to the number of positives that are identified of people with symptoms or contacts with a positive case. So we need to maximize the use of our labs and of the materials used for COVID-19 testing in order to get results. We need to maximize the use by testing the appropriate people. And so that is a bit of an explanation about why we contact trace the way we do. And it's important to note that there are people who do ask to be tested at this point who don't have symptoms or who weren't recommended for testing by the public health team. Even if our testing site at KMHC were to test you, it can be very likely that the lab will refuse to do the test. So, our team is very knowledgeable and able to help you decide whether you need to be tested or not. But again, talking about empowerment, on our COVID-19 KMHC website, if you go to the COVID-19 section, the banner at the top, if you click through the elements on the banner at the top, and I didn't think to pull it up today, but if you click through, you'll see a self-check form, and by completing that self-check form, it will actually tell you whether you should be tested or not, and it will give you the number to the KMHC testing site. So just a reminder, that form is there, a self-check form, and you can use that to determine whether you need to be tested or not. So lastly, I want to move to visitation. So Lloyd spoke a little bit about task force plans. We spoke a little bit about it this morning, and considering the indicators that we use and what we're seeing in number of cases increasing in the communities around us as well as within our own community, we are very likely going to be moving quickly to our red planning phase, and we'll be giving you a lot more information about that tomorrow. But there are 2 things that are important to tell you today that is in the process of happening. Number 1 is education, and they are working hard on their plans for moving towards online learning, and you'll get more information about that probably by Thursday. And secondly, we want to talk about visitation at the Elders Lodge, at ILC, and at KMHC. I'm going to pull up the plan that we've been showing you for a couple of weeks now in preparation. And we didn't expect to be going through our phases quite so quickly, but unfortunately we have to follow the numbers and the data as we see it and respond accordingly in order to ensure safety for our most vulnerable population. And so in that respect, what I would like to say today is that visitation will be moving to red visitation phase as of Thursday morning for KMHC, for the Elders Lodge, and for ILC. So at KMHC, families of residents were contacted today so that they could be advised prior to us coming and advising the community. And the residents were also advised today individually so that they can be made aware that this was happening. So visits planned and scheduled for tomorrow will be maintained. However, as of Thursday morning, we move to more restrictive measures where end-of-life visitation will be maintained, and we will also have visitation from natural caregivers. And again, if you have questions about our natural caregiver program, then we urge you to call inpatient and speak to Gail or Robin, sorry, regarding natural caregivers. But most people who are natural caregivers have already been contacted and are in the process of receiving training for their visitation and support that they will be providing. So that red that you saw is KMHC, Elders Lodge, and ILC. But what I also want to show you and speak about what's being maintained are certain services and activities a little bit different from in the first wave in order to really focus on well-being of the residents, even more so than in the first wave. This is through lessons learned, through having many meetings with family members, with residents themselves. And so some of the elements that will be maintained in the red phase is dining in the dining room, of course, with physical distancing, group activities with physical distancing, important urgent medical appointments are maintained, certain services, educators, physios, OTs, certain services where required are being maintained as well. So that's important. And of course, when I spoke about natural caregivers, that's a big change from the first wave where nobody was allowed in. But in this second wave, caregivers who routinely provide care to their loved ones will be able to continue to provide that care, of course, with the appropriate training and protection required. So I'm going to just talk a little bit lastly about KMHC and some of the preparations that are underway, very similar to the first phase. We've, for the past couple of weeks, been preparing our contingency plans. As you know, right now, there's no impact to home care services, outpatient care. All services will be maintained as they have been over the past few months. However, our contingency plans allow for a priority on specific areas or services. So inpatient, of course, is a priority for a vulnerable population. Should we lose staff who have to self-isolate, we have to have plans in place to ensure that we have the appropriate amount of resources to meet the needs of your loved ones. So those plans are already established. We have our testing site and we also have our public health team. Those are two areas that are especially important right now as we try to limit, contain the virus, and therefore there could be changes in our service offer depending on the needs that we might have or that might develop within those two services. And all of those plans are being implemented, but we will of course, keep you posted as things progress so that you're continuously aware of the changes that are happening at the hospital. So that's my update for today. I, again, really thank you for your patience, your collaboration, your understanding. We are all making the best possible decisions that we can for the safety of our loved ones, and it would be really, it's really great to have everybody's collaboration as we move forward. So, thank you.
Thank you very much, Lisa. And again, there's a lot of information here today. There will be more details tomorrow. There is a task force meeting in the afternoon, and after that, after a little bit of a meeting, a recap, and then another report for you. And as we stated quite often in the past, we had gone down to 2 days a week. Well, obviously now there are going to be a lot more updates as we head into this very difficult time. Just a note, a couple of notes actually. One of the things that started earlier this week, and it was planned for, was the daily information bulletin about the status. What status are we at? If you look in the corner up here, you'll always see from here on in the status right on the screen, and so that's one of the things that has been done. Also, just wanted to mention that if you didn't get all the information that you need, all you have to do is go to COVID-19 at KMHC.ca, and there is just a ton of stuff. And Lisa mentioned earlier the video that ran yesterday from British Columbia. Just look at yesterday's program. That's there as well. Today's 134, so if you look at program 133, just scroll onto that and you shall find it. But there's just so much information out there. We'll do our best to make sure that you have all the information that you need so that we can keep ourselves safe. And as Dr. Gauthier said yesterday, we got this, Kahnawà. So take care of yourselves. We shall be back tomorrow. And on behalf of everybody at the COVID-19 Task Force, Niao Koa Dano, Onigiwahi.